Hi, good afternoon. My name is Jessica. This is Module 3 discussion. I am on Team 1, which is in support of omega-3 fatty acid in relationship to diabetes, heart disease, and overall health. Omega-3 fatty acid is considered an essential fatty acid. Our body does not make it, so we have to consume it, whether through a dietary or supplemental source. We can get this through fish, krill, some plants, nuts, and oils. Omega-3 plays a effective role and crucial role in brain functioning as well as normal growth and development. The American Heart Association suggests eating fish at least 2 times a week, mainly fatty fish such as lake trout, sardines, tuna, mackerel. Omega-3 aids in reducing inflammation, lowering the risk of chronic disease, heart disease, cancer. There's a large abundance of omega-3 fatty acid in the brain, and it appears to be very important in cognitive function and behavioral function. There's been a couple studies done on infants who did not receive enough omega-3 during pregnancy through their mother, and it showed as having consequential signs and symptoms such as lack of vision, developing vision, and nerve problems. So, signs and symptoms the patient may present with omega-3 deficiency, such as fatigue, poor circulation, memory loss, mood swings, and heart problems. Omega-3 helps with reducing inflammation. I have several studies that suggest that omega-3 is effective, several in which talk about diabetes and hypertension. There's an article based on primary and secondary prevention of type 1 diabetes. This study took into account immunological mediated diseases and did some dietary and nutritional changes and added omega-3. The studies show that secondary prevention studies with the use of vitamin D, gluten foods, omega-3 show a reduction of the incidence of immunological mediated diseases. And that study was done by Schuyler in 2012. My next article was omega-3 and omega-6 fatty acid in type 2 diabetes, done by Stiller, Jepsen, and Schultz, and this was done in January 2013. This took into account that polyunsaturated fatty acids such as omega-3 are of particular interest in nutritional therapy, and they used supplemented omega-3 with people that were type 2 diabetics. It showed a lowering in triglycerides and VLDL cholesterol, and there was also a little bit of an increase in the LDL. Omega-3 fatty acids are from the latest evidence show no mortality or cardiovascular disease, but it helps with glucose control and hypertension. It has suggested that omega-3 be added to a type 2 diabetic diet. And that article was done in 2013. I think I said that. This is my next article. It's through the Pediatric Diabetes article. Its title is Omega-3 Polyunsaturated Fatty Acid, Reduce of Insulin Resistance and Triglycerides in Obese Children and Adolescents. The study was based off of 201 obese and insulin-resistant children. The results showed at baseline the age, BMI, and insulin resistant in children of both groups were comparable. The results showed that with the use of omega-3, that the triglycerides decreased, which affects BMI, and that the results suggest that omega-3 may be used as an adjunctive therapy, not necessarily a primary treatment for diabetes. And that was also published in 2013. My next article is Omega-3 Index, Obesity in Insulin-Resistant Children. This showed that obese children taking omega-3 showed a moderate decrease in reduction of chronic diseases later in life. It showed the importance of omega-3 in prevention of obesity, and it suggested that starting a adolescent out with omega-3 that would prevent future injury and chronic disease processes. And that was done by Burrows and Collins. Also was published in International Journal of Pediatric of Obesity. My last study is the effects of omega-3 on blood pressure and the relationship between serum stattin level and blood pressure in patients with type 2 diabetes. The result of the study showed that there was a significant change in the mean difference of systolic and diastolic blood pressure. The blood pressure showed a significant reduction of omega-3 group compared to the placebo group. So the conclusion of this study showed that daily consumption of omega-3 would aid in type 2 diabetes, such as reduction of glucose and A1Cs. And I felt like this was great evidence that showed how much omega-3 can reduce blood pressure and help with hypertension. I will publish the citation for all my sources so that if you're more interested in more information, you can also get some more and see the articles as well. Omega-3 has a little bit of influence with blood pressure, helps with hypertension. There was analysis of about 17 clinical studies with fish oil, and those who were taking 3 or more grams of fish oil reduced blood pressure. A lot of people take omega-3 to prevent cardiovascular disease. It's one of the best ways to help prevent heart disease is eating a low saturated fat, eating foods rich in monosaturated and polyunsaturated, which that includes omega-3. Diabetes, we talked about how these articles even examine that omega-3 helps people with diabetes that have high triglycerides and low LDL. Omega-3 fatty acids from fish oil can help lower those triglycerides and apoproteins, which are markers for diabetes. There's been a few studies with rheumatoid arthritis and lupus, which are both autoimmune diseases, suggest that they found that fish oil, along like in rheumatoid arthritis, fish oil used along with a non-steroidal anti-inflammatory drug, that it actually reduces the signs and symptoms of RA. There's been little studies done, but there have been studies done with omega-3 and depression. It said those who taking omega-3 said that it helped, taken along with their antidepressants, showed a greater improvement of symptoms than those who took the antidepressants alone. So it has a little bit of mood effects as well. As we talked about earlier, there's a high concentration in the brain of omega-3. I will post my citation in written format after this is done. Thank you for your time.